Happy Twin Tuesday!
Twin Tuesday!
Woo woo.
We got both of our hands free right now. That's right, for a second anyway. So we'll see how much of this video we can get through without Dakota being in the arms.
Yeah.
But
So,
it's
who
all
are
good.
we?
I'm Dr. Johanna.
I'm Dr. Madeline, and we're not sure since we're not holding a baby if you can tell which one's which.
Yep, so we make sure we want to introduce ourselves, and we are twin chiropractors at Atlas Chiropractic Center, which is located in
St. Pete, Florida.
Yes.
We are family wellness, but our jam is pregnant and postpartum moms. We love supporting women through their motherhood transition.
Yep.
And if you are hopping on, throw us some love. Hey, Stuart. So drop some nice emojis down, throw us some love. If you are catching the replay, let us know. Say replay. If you're not local, let us know where you're at. Say hi. We're super excited.
Yep.
So it's been a little bit since we talked about our pregnant and postpartum moms. So
It
we
has
wanted to bring it back a little bit
Mhm.
because we get questions about it every day, and we're here to support them, and we want to help educate you, especially if you're watching this, knowing that there are people in your community, if you're here, and if you're not in St. Pete and you're watching us and you're pregnant or you're thinking about it and you need support, that you can reach out to us as well, and we can help find that person in your community, because there are other communities too.
Yep, absolutely. We can definitely find you someone that does specialize or excel. We can't really say specialize in the state of Florida, that's why I put it in quotations. But anyway, and pregnancy care. And I'm a little biased, obviously, because I am a chiropractor and I've been using chiropractic even before I was pregnant. But I could not imagine going through what pregnancy is and your body rapidly changing so quickly without getting any type of adjustments.
Right. So we have a lot of moms come in with pregnancy pains. So what are some common pregnancy pains that we see?
Oh my gosh, sciatica, so low back pain that goes down into the leg, that would be like your sciatic type of pain. Round ligament pain, so round ligament pain, as you know, is like in the front of your lower abdominal area.
And also the side there,
Yep.
both sides sometimes, maybe just one side other times.
Groin pain, like pain actually at the like pubic area, because that area does change and it stretches and opens so the baby can come out, and it obviously happens at such a rapid pace. I also have noticed a lot of patients telling me they have like upper back discomfort, neck pain, and headaches too.
Right.
So even though pregnancy happens and you see so many changes happening in the belly and in the front, it can actually drastically affect your posture from top to bottom.
Well, your whole spine's connected. Everything's connected. Your hip bone's connected to your upper back bones, to your lower back bones, to your legs. Essentially, I know that's not exactly how the song goes, but you get my point? So it is all connected. And a lot of times when we have moms or women come in here and they're experiencing those things, they've already went to maybe their other providers who, when you're pregnant, you don't have a lot of other options to manage those aches and pains.
Right, absolutely. And you really don't, and which is kind of crazy because you actually have a lot of options to manage those aches and pains.
Yeah, that's not
specifically from more of a like holistic type of wellness approach, which may be very different for some people's mindset if they've never like dabbled in that area before.
Right.
So of course we are chiropractors, so we're going to talk about how chiropractic can help that. But like I'll tell you, even through my pregnancy, I did acupuncture, prenatal massage, I did all kinds of stretching and exercising and things like that. So like there's just like a variety of things you can do to stay happy, healthy, moving, and pain-free during that time.
Well, pregnancy and labor, labor is like the most physical thing a woman may ever have the chance of going through, ever.
Yes.
Right? So think about it. Pro athletes have chiropractors and physical therapists and acupuncturists to help take care of their body, because they're constantly out there and they're putting so much stress on it. So,
yeah, absolutely. I saw one of my colleagues post the other day about one pro athlete. Oh my gosh, it's not my jam, but I think it was maybe a pro baseball player. But they were vouching for chiropractic helping with the shoulder and decreasing the pain and allowing them to actually do what they need to do. So great comparison, because those people are actually utilizing these wellness services each and every day to excel and to prevent injury. Why wouldn't we do that for our own selves? We just have to put ourselves in the mindset that we are either a corporate athlete or our bodies are athletic. They're going to go through this athletic change when you go through labor and delivery. And I know I trained for that. I didn't think that, oh my gosh, I'm pregnant, I can no longer work out. I trained.
If you are talking to us, or you see us in the office, or you follow us on social media, you know that we preach this. Women should train for pregnancy because it's so physical. It's not only physically taxing, but it's emotionally and spiritually. So we have to hit kind of all those caveats to support you the best in that. So working out, but safely, and how do you know what that means? So I have special training in that, so I can help you with that. I'm very passionate about my prenatal, my pregnant and postpartum moms working out safely in a way that serves them.
Yep.
So if you have any questions on that, please reach out to me and please let me know. We'll get you all the answers.
All the answers, all the things, right? So one reason we're standing in front of this poster, and I know it's backwards to you guys because that's how the screen changes it, but it talks about benefits of prenatal chiropractic care, so benefits of getting adjusted while you are pregnant, and we're going to hit off with the first one, which is greater comfort. So it provides greater comfort through pregnancy, and if you're very active on our Facebook page, I just posted an article, that was a research article, that says that there was positive showings that going through chiropractic care while you were pregnant helped reduce low back pain, and it helped you sleep better as well. And maybe that's why, don't hate me because everyone's pregnancy is different, I had no problem sleeping when I was pregnant. Like, even like up until the day my water broke, I slept like a champ.
Yeah.
I don't sleep now because I have a baby, so it's payback, but I did sleep awesome.
But overall comfort. So you come in, we are especially trained to see pregnant women, which not all chiropractors are.
Correct.
And we do a special evaluation. We get them adjusted properly so we can help ease those pregnancy aches and pains.
Yep.
Drug-free, and your body gets to move and feel better, which is awesome.
Yeah, so what else do we got? So the next one is labor time. It reduces the average
usually most
labor
women's
time.
favorite.
Yeah, it is usually the favorite, and just a little caveat, like, most of the time, not always, your first labor is like the longest type of labor. So I also could not imagine how long my labor would have been if I wasn't under chiropractic care, because it was still very long in my opinion. But with that being said, it does reduce labor time. There's research out there that actually shows that. So no matter if that means it reduces it from 40 hours to 30 or from 10 to 5 or something like that, it still acts in your benefit because it allows for your body to work how it's supposed to, so baby comes out.
Right. Well, it reduces your labor time, and it also reduces your chance of medical intervention during that process, which is huge. It's huge. This is just another tool that you can have to your tool belt, another way to empower yourself. If you were thinking your birth plan doesn't include things like Pitocin, C-section, and if your birth plan does, again, there's nothing wrong with that. Just be empowered and educated in your decision, but this still helps your process, no matter what your choice is, to be easier, so to say, for you, because labor, no offense, it's never going to be easy. Like, it's not made to be. You're bringing a human earth side, which is so cool. You got to work for it a little bit. It is a life.
So the next one is one of my favorite ones, fetal position. It encourages optimal fetal position. So it actually helps the baby get into the best position possible so baby can come out and reduce labor time and have less strain on baby and mom. So what that means, some terms that you may hear is if people say their baby's breech, if their baby's not in the right position, their baby's crossways, like they're transverse. These are all things that we actually get referrals from midwives and OBs in the area to help, because it's a non-medical intervention of balancing the body to give your body the best chance it has to get that baby in the right position.
If you're interested and you are somebody who you're having this issue right now and you're not sure what to do, or you know someone who is, I did put out a video a while ago, so we'll try to link it in here, that if baby's not in proper position, what are some ways what can you do to try to work on that?
There's a variety. I mean, chiropractic is just one of them.
Right.
So
that, as long as too, is, are we adjusting or moving baby?
No. That's not what we do. We can't even claim that we turn or send baby, because that's not what is happening. That's what's going on. It's a body balance. It's relaxing muscles, ligaments, and realigning joints that are out of alignment to free up space so baby can do what baby needs to do, because innately, like how the body's designed is baby's head is heavier because gravity pulls it down. It's supposed to go down to the birth canal.
Bodies are pretty awesome. They know what they're doing, as long as we help them remove any stress that's blocking them.
Yep, absolutely. And a side note to that, 'cause I know we talked a little bit that you may be local or you may not be. If you are someone that is going through a breech baby and you don't want to go through the different intervention routes, or you want to try everything as much as possible before getting to that point, you can just tag yourself or private message us, because we may not be able to help you, obviously, because you're not local, but we can know a lot of chiropractors and ways to find someone that is what we call Webster certified, and that's the type of practitioner that you would want to see.
Absolutely.
As far as chiropractic goes.
Yeah.
So next on our list, and we talked about this a little bit, is pain relief. So going through chiropractic care when you're pregnant can reduce headaches, neck pain, mid back pain, low back pain, sciatica. It can just help you feel better.
Yeah, it does. And not that we're always going to take it all away, because I always tell my mamas this, your body's changing so fast through the pregnancy process, and baby's growing so fast that there is a lot going on there. And then if you've had any sort of like weakness in an area or prior injury, you can be pretty much guaranteed you're probably going to be made aware of it during your pregnancy.
Right.
But we're here to just support you through that process, so you can be in less pain or not for as pain for as long, so you can get better sleep. So you can, again, wake up and be less cranky and happy, enjoy your pregnancy.
Yep, absolutely. And when you get to the other side and you're doing your postpartum care, we still recommend that patients get adjusted postpartum, because relaxin is leaving the body, which is that crazy hormone that loosens everything up so the baby can come out. And you want to make sure the joints get back into proper alignment, because in that respect, now you're doing all kinds of things you weren't doing before.
Yes.
So you're nursing around the clock, or you're feeding your baby around the clock. Now if you're nursing or bottle feeding, you're in crazy postures and positions, picking the baby up, you're sleep deprived more than likely. You get a lot of wrist pain. We'll do a whole nother video on that, because that stuff is crazy. We need to talk about it because no one told me, and if I knew, I would have done things way different. So it can also help on the back end when baby's already earthside, on ways to reduce pain and discomforts too.
Absolutely. It takes about 9 months, really a little bit longer, to grow baby. So it takes the same, about 9 months, for your body to get back to its new normal. I say new normal because it's different. It's not going to be 100% what it was prior, because you created a life and you brought baby earthside, which again is awesome. So celebrating that.
Yep.
So in my opinion, your body's even stronger and more resilient. But how do we support it within that process? Because you're going to be doing a lot of changing over that 9 months. You're going to have a lot of extra stress, like Dr. Johanna knows all about right now. So we want to support you within that process too. Just stopping after baby's earthside and thinking that there's no stress on your body, a little cray.
I think the tag to that is slow is fast, and recovery from baby, which is a huge misconception, because that's not the way our society is set up. But what that means is, like Dr. Mallon said, it can take up to 9 months or maybe even more to start to rehab and get that body back to where maybe it's feeling more normal to you. And that's not the case for everyone, but it does take time, and you should give yourself grace, because 100%. It takes time and it's crazy. You have this whole new life and you're trying to figure it out, and
that's okay.
Yep, it's
that's
totally
completely
okay.
100% okay,
and you will get there. So, what else? So we talked about reducing pain relief. The last one on the list is it naturally supports a natural labor and delivery, if that's your goal and plan. If your plan is medicated, hospital, whatever, it still gets your body in the right position to help you recover faster from whatever type of labor and delivery you have.
Yes.
Or
Even
whatever
a C-section. Even a C-section.
Absolutely, absolutely.
Yes.
And so that is just, I mean, there's so many great benefits to seeing a chiropractor when you're pregnant and when you're postpartum.
There is, and we love seeing you out here and taking care of you. And then meeting baby when baby comes to earthside is so cool.
So I got just like a couple of quick things on my mind. When we adjust a pregnant mom, I know we mentioned it earlier, but for anyone that's new tuning in, do we adjust the baby when the baby's inside of them?
We don't adjust the baby. We don't touch the baby. We don't move the baby. None of that.
When the baby's inside.
Just working on mom. Just working on mom.
Yeah, and when the baby's inside, we're just working on mom, and they may move and jiggle because they like it, because we're making more room for them. So that's pretty neat too. So we're not adjusting the baby when they're inside. No. Is it safe to get adjusted while you're pregnant?
Yes, 100% safe. But caveat, asterisk to that, through a Webster certified chiropractor. And we are not all Webster certified out there. If you're a chiropractor, it does not mean they're Webster certified. My favorite example is when Dr. Johanna became pregnant, she didn't go to her primary care. Through her pregnancy, she went to somebody who specializes in pregnancy and pregnant care. Same thing.
Yeah. So you
for chiropractic.
Just when you're looking for it, that's what you want to look for there. And same with postpartum care, because again, additional training postpartum, which not everyone has either. So it makes us pretty special and unique and different. So any other things that you think that people out there are curious about as far as getting adjusted when you're pregnant, or if their wives can come in and different things like that we didn't go over?
One that it's safe, it's comfortable. If you have questions, though, call and ask and kind of interview your doctor. There's nothing wrong with that. You're hiring us. So we want you to feel comfortable in whatever choice you're making. We want you to feel comfortable in our office. I've talked to other moms who have went to other offices and they weren't necessarily given an exam, and they just deep down inside didn't feel comfortable. If you have that feeling, listen to that. Your body is telling you something. So keep that in mind too. And if you're not getting results that you want, talk to your doctor or look at it like a second opinion, because they're all out there.
Yeah, they're all out there, and we love what we do. We love seeing you guys, and we love seeing the pregnant mama.
It's safe. It's a great option, and
I mean, just from speaking from experience, it was a whole different experience I had with chiropractic. Even though I've been under chiropractic care for a long time, being pregnant and receiving those types of adjustments, I mean, I definitely looked forward to them. It helped my body get ready for labor and delivery. It helped me through labor and delivery and postpartum, and it was just great. It was awesome.
I guess one thing too is we did talk about a lot about like the pain relief side and helping your labor and delivery, but we will also talk to you about those other like your mindset and prepping for birth, talking about a birth plan, talking about a postpartum support plan,
right,
and what that looks like for you, because we're here to empower you and educate you so you can make the best choice for you, and you're always going to feel better in whatever outcome that is if you're educated and you know going into it your different options, even if it's not an option you want, at least knowing. And I know that maybe not everybody necessarily does that, but we do that here. We make time for that here, and we're going to check on you the whole time too to make sure that you're not experiencing any type of like postpartum or even prenatal depression or anxiety, because we want you to get support within that too, because it's normal. It's common. It's not normal. It's common that I can experience
that
it.
Stuff is real.
It's real. We want you to be supported within that process too.
Yep, absolutely. So that's how awesome chiropractic can be for pregnant ladies, pregnant moms, and postpartum. So if you have any questions, of course, drop them below. You can send us a private message if it's a little personal, and we'll get back to you. And we have some cool things coming down the pipeline. I'm not sure if Dr. Mallon's ready to release them or not yet, but you can just recap on what we're doing, because the end of the year is near.
The end of the year is near, so we have kind of a nice wellness option for all patients if they're interested. So if you're here and you're a wellness patient, you know that we have some wellness plans. So we're kind of up in the game a little bit. We're offering you things that you guys ask us about all the time. Exercise. I need to work out. I need to lose weight. I need a stronger core.
So support and accountability outside of the office.
Outside of the office, yes. So we're still coupling adjustments in there. We're coupling workouts in there that are designed for you by educated people who know your body and know what's right or wrong for your movement, and can support you in that. And there's some other like cool e-courses in there too. So if that's something you think you're interested in, drop an emoji below, like, hey, me, so we can let you know, and we'll tell you all the details. And we're running it for a special price until the end of the year. At the end of the year, it will go up, but it is something cool that we are adding in. I'm super excited about it. So also with that, if you are pregnant and postpartum, I'm also designing very specific exercise programs to support you through that process that can be done either in your own gym, at home. We'll kind of talk and see what you have available, because working out through both of those looks completely different. And I want you to be supported with them in that process and know what are safe things for you to do versus maybe some other things we should be changing right now. What's the scaling? What can you, all those things, so you don't get injured.
Stuff. And don't forget that through the end of the year, any of you, your loved ones, your friends and family, you can refer in for just $20 consult and exam.
Just $20.
So just kind of a nice little gift of health during the holiday season, since it's more stressful. Go ahead and tell them that, and if they mention it when we talk to them, we will honor that price.
Yeah.
So happy Tuesday, y'all.
Happy Twin Tuesday.
Yes. We will be back next week.
Next week with something awesome.
Have a fantastic time.